So what would you do? Would you analyze them? Would you talk to them, counsel them? What would you do while they're in the hospital?
Well, do a full assessment with a multidisciplinary team and make determinations about proper treatment, proper therapy, medications, and the like to treat the symptoms.
And generally, what would the symptoms be, sir, in your experience?
Symptoms of postpartum depression?
Yeah.
Okay. Well, certainly within that period of time around birth or after birth, the DSM has a 4-week period. Others expand that to as much as a year. But certainly depressive symptoms postpartum are similar to the symptoms that you see in a regular depression. You can have suicidality, you can have guilt, changes in appetite, changes in weight, changes in concentration, changes in physical activity. You can also have significant problems with sleep, either sleeping too much or not enough. So these are depressive symptoms that come in the postpartum period and require assessment and treatment.
Are you aware, sir, in your practice or studies of the number of women that commit suicide during the postpartum period? Are you aware of that?
I can't quote you a figure.
Do you have any clue at all?
No.
Would you agree with me, sir, that one of the unfortunate components of a woman who has had a baby and is suffering from postpartum depression and living with it, that can, on a dime, turn into postpartum psychosis very quick, right?
It can be rapid.
And you indicated, sir, that there, according to the DSM, is a 4-week cutoff for symptomology, and then you mentioned that there are others. Is it the World Health Organization that you said that talks about a year?
Correct.
There are some other psychiatric organizations that talk about different periods of time, 6 weeks, 8 weeks, right?
Correct.
So when a woman is dealing with these symptoms and goes to a doctor, or even you, when you're treating, as you indicated 15, 20 years ago, you were treating, is it important to take a blood test?
I'm sorry, can you repeat that?
I'm sorry, my bad. Is it important to take a blood test?
Is it important to take a blood test?
Yeah, you just went through the whole thing about we're going to have the team and they're going to evaluate and we're going to prescribe. I'm just asking, is it important to take a blood test of the patient?
It can be.
Based on what?
Based on the presenting symptoms, based on the history, based on medical history. For example, if someone has recently been in a hospital and been treated, there may not be a necessity for drawing blood again, depending on the types of symptoms that you encounter. It's not a standard that everyone who presents to a psychiatrist requires blood tests.
So if you're a psychiatrist who's been practicing private practice for about, I don't know, a month, maybe 2, and is prescribing antipsychotic medications, selective serotonin reuptake inhibitor medications, benzodiazepine medications to a young woman who is complaining of what the young woman perceives to be difficulties postpartum. Is it important to take a blood test to find out what, if any, prescription drugs they have on board in their system?
to check and find out, did you say what drugs are on board?
Yeah, I mean, you're treating this patient, right? And they're coming off hypothetically with you, but they're coming off the street to see a psychiatrist for help, right?
Yes.
And if they're already been prescribed drug after drug after drug by a particular doctor with their 2 months of robust experience, is it a fair statement that you should take a blood test of that person?
Well, it really depends on the medication. There are some medications that really require blood tests because of levels and the like. Many psychotropic medications are not there's not an easy test for the amount of medication in the system. So it depends on the circumstances, and it depends on the medication. I mean, for example, lithium or carbamazepine or valproic acid, those are all mood stabilizers. Certainly taking a blood test would be very important. So it depends.
Depends. Can I just ask you to spell those 2 drugs that you just pronounced for the stenographer, please?
Carbamazepine.
Yeah.
Carbamazepine.
Okay.
Valproic acid, Valproic acid, also known as valproate, Valproate. And did I mention lithium?
That's not a hard one. The record has to be accurate, that's all.
Understood.
Okay. Now, doctor, are there other tests in your experience that are or can be or should be administered to a young woman or a woman who's had a baby and is coming to a doctor, like Dr. Tufts, for example? Are there other tests that can be administered to determine if, in fact, that person is suffering from postpartum depression?
I'm not aware of any specific test that specifically diagnoses depression. Years and years ago.
Oh, postpartum depression, sir.
Pardon me?
Postpartum depression is my question.
Correct.
Depression. I know you want to say it's the same thing, but postpartum depression is my question.
And you're asking if there's a blood test for postpartum depression?
I'm asking if there's any tests at all that a psychiatrist can or should administer to the patient coming to them for help.
Well, there's the Edinburgh scale, which is a self-report that patients fill out for who are postpartum.
You looked that up last night?
No.
No? You knew about the Edinburgh scale?
Yes.
You administered the Edinburgh scale?
Pardon me?
Have you administered the Edinburgh scale?
No. It's a self-report, usually given by nurses.
Nurses, okay. In any event, it's a scale that is a useful tool to determine the level or degree of depression that a person may be expressing that is suffering from postpartum depression, correct?
That's right.
And do you know what the numbers are on the scale? Like, is it 1 to 23, or is it 1 to 50, or do you know what it is?
It's a 30-point scale.
And when you say
so 1 to 30, as I understand it.
And when you say a self-report, the patient would then advise what symptomology they're suffering at that particular point in time, right?
Correct.
And then the doctor would then determine whether or not there is a risk or an extreme risk or a deadly risk of this person committing suicide, harming someone else, whether it's a baby or anybody else, and determine what the level of their postpartum depression is, right?
Yes, it can help.
And did Dr. Tufts administer Edinburgh test to this young woman?
I know that, Ms. Clancy, there were a number of Edinburgh tests that were given to her, so that there are some scores in her record. I can't recall which practitioner gave her the Edinburgh test. but I do recall that there are a number of scores within her medical record.
Right. And what was her highest score?
The highest score that I recall was 23.
23 out of 30, right?
Correct.
And over 15, the patient is in pretty serious trouble, right?
Over 15 is concerning, definitely.
Right. And she was a 23. Right?
Yes, I believe so. I think they ranged from 19 to 23, just
Right,
from my
they
memory.
increase as time went by, right? She was getting worse,
Correct.
right? Yeah. All right. And in addition to the regular blood test, which costs like, I don't know, about $100 to administer a blood test to see what somebody's got in their system. It's not a lot of money, right, for the insurance company.
I just didn't hear you.
Blood test. It's not a lot of money for an insurance company to pay, right, to cover.
Correct.
Okay. So do you feel that it is reasonable medical procedure for a psychiatrist dealing with a woman who is expressing under the Edinburgh scale off the charts or serious trouble, who is on medication, as we went through, the antipsychotic drugs, the SSRI drugs, the amitriptylines at the end of the period of treatment with these people, the benzodiazepines, it's helpful to take a blood test, right?
It can be.
And is that, in your opinion, sir, to a reasonable degree of medical certainty, a step that should be taken by a competent doctor?
That taking blood tests can be appropriate, yes.
And then there's an additional blood test that you can use when you're dealing with a woman who's suffering from postpartum depression or coming to the doctor for help and they have significant narcotics or prescription drugs in their system, and that would be an enzyme test, right?
I'm not aware of an enzyme test being typically available or used.
Well, it costs a lot of money, doesn't it? Like it costs a couple of grand?
I don't know.
All right. In any event, sir,